Okay, so firstly, I'd like to introduce myself. So my name is Melissa Lee. I'm the clinical lead for our physiotherapy services at Care Square. So thank you for your time in attending this webinar. There is a chat that you can also use if you need to ask any questions throughout the webinar session. Feel free to pop in your questions in the chat, and I'll be able to answer them at the end of the session as well. All right, so let's start. So you all should be able to see the PowerPoint presentation on your screen. If you cannot see it, let me know on the chat. Okay, so really today what we're discussing here about is home-based physiotherapy programs within the NDIS and how to get the most out of them as well. And what we'll be looking at is really what the role of the physiotherapist is, looking at our physiotherapy services, looking at the common barriers that impact intervention, and then looking at the factors for successful development and implementation of a physiotherapy program as well. So first things first is, what is the role of a physiotherapist? What do we do? So in a nutshell, what we do is we help the NDIS participants with various conditions, disabilities, to improve their daily living function, mobility, to enhance their abilities, whether it's at home or to access within the community through gross motor training, such as balance, strength, and gait retraining as well. So a physiotherapist can pretty much help with a number of things. So some of the most common things that we can help with is prevention of falls. So particularly if a participant has a history of falls, or if they are a falls risk, whether that could be due to poor balance, poor coordination, or just poor mobility, that's something we can definitely help with as well. If they have issues with completing self-care or household tasks, and whether that is limited due to reduced functional tolerances, for example, reduced tolerances in sitting, in standing, not being able to reach, not being able to lift, not being able to bend. These are sort of things that we can sort of help with as well. Also, we can help participants moving around inside and outside of the home. So again, if they've got poor mobility issues, whether it's due to poor balance, poor coordination, or if they're unable to mobilize on stairs, or even on uneven surfaces, particularly when they're out in the community. Also, if the participant is completing daily jobs, sports, or hobbies. So again, if they're limited by reduced strength or endurance, or range of motion, or stiffness, for instance, so that it's impacting on their daily task, on their sports, on their occupation, or on their hobbies and interests as well. Probably a big one that we can help with is definitely managing pain and chronic conditions. I know a number of participants that we see have a lot of chronic conditions where they suffering through chronic pain. So we can definitely provide pain management strategies to be able to help them manage their day-to-day activities, and just to be able to help them to self-manage as well. And another thing that physiotherapists can help with is through prescription or training and education on assistive technology such as walking frames, braces, orthotics, AFOs, and things like that as well. And particularly if a participant is needing guidance and support through a prescribed exercise program to improve their physical health and function, we can definitely assist there as well. So I guess it's just important to know in terms of our physiotherapy services, exactly what do we do? So we always provide a thorough assessment, and really this assessment is important to obtain a better understanding and background of the participant. So we do this generally in two parts. One is a subjective assessment. This is what I call is the how. So this is understanding, again, what their disability is, understanding their background, understanding things like their sensory, motor sensory needs, their level of cognition, their communication, their interests. This will then help determine how the program or how the intervention will be implemented. Followed by this, the second part of our assessment is we do a thorough objective examination. So it's more like a physical assessment. So really this is more to assess their movements, their mobility, their function, their task. And really this is the what, which is what actually determines what the physio program will include, but also what is the focus of the interventions, just to ensure that obviously we're achieving their NDIS goals. And obviously following this is a written report, and this written report is based on the assessment, but it provides that evidence and clinical reasoning for the recommendations of supports and services. And then obviously if intervention is recommended, then obviously we provide sort of tailored specific intervention programs that's specific to each participant and ensuring that they're achieving their NDIS goals. So this is the what of the objective examination in terms of intervention strategies that we can include. Could be tailored exercises, could be education, could be self-management strategies, could be pain management, manual therapy, gait retraining. The list is endless, and we will obviously go through more of that about intervention later as well. So before we go through the factors for successful development and implementation of a physio program, it's important to note what are the common barriers for intervention. And I'm sure a lot of you probably can rattle in your head what are some of the most common barriers. Definitely one of the most common ones would be lack of motivation and low mood. I mean, how many participants that we know of, or how many even people, friends who just lack of motivation in wanting to do things. So this is obviously a very big one, because obviously, you know, why would they want to engage if they're not bothered? You know, do they have psychological symptoms that are heavily impacting on their mood, that's impacting them on their ability to engage or participate in the program? So this is one where we need to look at in terms of, you know, do we need to collaborate with their psychologist or their counsellor to see how physio can be incorporated that way? Or sometimes, you know, there's actually studies that shows that actually completing exercise or physical activity can actually improve mood as well. So sometimes just participating in the exercises can actually improve their mood and motivation as well. Another big one is probably time, and I'm sure we're all guilty of time being a barrier. You know, obviously we always say that we're always busy, we don't have time to do this, to do that. Interestingly, with this COVID restrictions, we've somehow now have got heaps of time to do things, but yet we still find excuses of why we can't, you know, clean up the house or do home renovations because of time and things like that as well. Probably another common barrier that we see is poor understanding. So most often, sometimes participants they are unsure of what they can do or what to do, or they don't understand the purpose of the program or why they are doing it as well. Another big one that we see as well, and not just in participants, but all over, is pain. Pain is definitely a big factor and can be a big contributing factor to their progress and moving forward. And as you know, pain is very subjective. How we perceive pain is very different amongst everyone. You know, two people could have the same injury, could have the same fracture in their lower leg, but how they perceive the pain could be so different. And I guess it's just managing, how can we manage these sort of pain behaviors that people are going through that's impacting on their intervention. And obviously, all the above pretty much leads to poor compliance. Another barrier is if people aren't complying with the exercise or with the programs, then that's obviously going to be a huge barrier, and that can be due to all the above: pain, poor understanding, time, lack of motivation, and low mood. So the next thing we're going to be looking at is the factors for successful development implementation of physio program, and keeping in mind these common barriers and how we can overcome these barriers as well. So first one is actually understanding the location and the environment. So this is quite an important one in terms of, you know, where will the intervention program take place? You know, where does a participant feel the most comfortable or spend most of their time? Is it at home? Is it at their day program? Is it out in the community? Is it in a park, or is it just in their local gym? Being mobile physiotherapists, it means that our physiotherapists are able to travel anywhere or to multiple locations. It means that they're not fixed to one area all the time. So a program can include sessions at a combination of multiple locations. For instance, I've got a participant that I'm seeing where we alternate sessions between the home, between the day program, and between the park. Unfortunately, due to COVID, day programs closed, parks were closed, so we've had to resort just to the home in that instance. So the fact that our physiotherapists are quite flexible, we can be adaptable to suit the needs of the participant as well. And it's important to note that by going to the participant, it means that the participant isn't having to step outside of their comfort zone. It's obviously easier to build rapport and to engage the participant if they are in a familiar place, particularly for those with intellectual or emotional disabilities. You know, sometimes being in a new environment is hard enough alone as it is. So you may not be able to get the best out of them in those situations as well. It also means that they aren't having to travel elsewhere to engage in services. For example, those participants with limited mobility, it's already an effort just to get out of the house, so let alone participate in a physio program. The last thing we want is for people, you know, to be traveling far to get to a clinic or a service, to be fully fatigued and buggered that they can't even participate in the program as well. So definitely a key one to note is the location. Where are we going to get the best out of the participant, where they feel the most comfortable, and they'll be able to engage as well. The next factor is understanding what available supports do they actually have. So whether that could be formal supports or informal supports, because particularly if you look at those barriers that we addressed earlier, if a participant lacks motivation, what daily supports are available to encourage and motivate these participants to engage? If they are living with a family member or their nominee or their main carer, then let's include them within the program so they can provide that ongoing support. Because as you know, frequency of physiotherapy sessions can vary between, could be weekly, it could be fortnightly, it could be monthly, etc. So it's not enough for the participant to engage in the program only when the physiotherapist is present. I've worked in private practice in the past where people will only do the exercises when they come in for their treatment session, but when they're out at home or in the community, they don't even participate in that. And obviously it's not enough just for them to do the exercises then or to do the program then as well. And so obviously by ensuring that the participant has the available support, whether it could be from the support worker, their family member, the carers, you know, having them, encouraging these participants, particularly those with that low motivation or low mood, just to give them that sort of additional support and encouragement as well to participate as well. And obviously this can be through education to the available support or including them in the involvement and implementation of the program during sessions. For example, I have a 7-year-old participant that I see who's got physical and developmental delay. She happens to be a twin who doesn't have the same physical limitations, but by involving the twin into the activities and the program, it actually has improved my participants' engagement, as normally we would need the twin to act as a role model for someone the participant can mimic. We also include the mother. She's very heavily involved within our program. So we do, you know, specific games or activities, the mum's heavily involved, and that means that the mum can pretty much mimic what we do during sessions during the days that I'm not there with them as well. So that way she's still engaging in these activities and that she's able to continue these sessions after school, but also to increase her engagement and improve her physical limitations as well. The good thing is that physios can also collaborate with other allied health clinicians, such as OTs, psychologists, speech paths, pathologists, to ensure ongoing engagement, and we can provide participants feedback to one another or provide any specific updates or observe findings that would be relevant to the clinician's program as well. So physios can also include support coordinators as well as part of the program, particularly if you've got a very strong relationship with that participant. And again, it's just a way of providing that additional motivation, that encouragement, that positive reinforcement, but also that feedback as well. And obviously we can provide that regular feedbacks to the family or the support coordinator throughout the program. So that way, you know, the support coordinator is aware of any improvements made or any key barriers that may be impacting on the progress of the program. However, if the participant doesn't have any social supports, which you know can happen, then obviously then we need to consider how we can increase the participants' engagement and compliance within the program, which we will discuss in the next slide. I've got an example of a participant that I'm seeing who's actually legally blind. So I pretty much included his support worker. He's pretty much in a group home 24/7, included the support worker in our sessions, because the only way for the participant to continue with this program is to be guided by the support worker on the days when I'm not there as well. So as we talked about, one of the main key barriers is poor compliance. Obviously, no one wants to be, likes to be told what to do. I know some of our participants don't like being told what to do. So really, it's all about coming up with how can we increase compliance? How can we get people to participate in activities or exercise that maybe they've never been involved in, or they've never really engaged in physiotherapy at all. So this may all be quite new to them. So really, how can we increase their involvement? So the key things that I like to look at is really making it fun, creative and interesting. No one wants to participate in a program that is boring. For example, as I said, that my 7-year-old participant that I'm seeing at the moment, she has a very, very, very short attention span and she gets bored very easily. So, rather than doing specific exercise, we actually incorporate various activities or games that is fun and engaging to promote the movements that we're wanting to improve. So we're wanting to improve her balance. We're wanting to improve her range of motion, her mobility. So we've just sort of incorporated games that we're pretty much just using that's around her home, and that way she's engaging in that way as well. And really it's all about incorporating what their interests are into the program. So again, if they like soccer, if they like watching soccer, if they like being in their backyard, or if they like playing with dolls, whatever it may be, we want to try and incorporate their interests in there, because it's most likely going to get them to participate and engage in the program more as well. So, for example, if they like soccer, then trying to incorporate soccer type movements or activities as part of the program. So again, we can try to incorporate that in the program as well. So again, like my 7-year-old participant, she loves balloons, she loves bubbles. So we've been able to utilize that to help improve her hand-eye coordination, her jumping, her lower limb strength and her balance as well. And also about increasing compliance is really incorporating their normal everyday function activities. Again, a lot of these people, have their set daily routine. And most of our participants don't like being out of routine, and they find being out of routine is actually quite challenging. So really, by understanding their day-to-day activities or their routine, we want to try to incorporate these tailored exercises or activities as part of their normal daily routine. So it doesn't look like that they're going out of their way to participate in the program or to do certain activities or exercises, but really what we're doing is we're just fitting in those exercises within their everyday activities. For example, I've got a 24-year-old participant who literally spends all day, every day in front of his computer playing games. So the thought of even exercising or taking time out of his computer is very, very challenging. So what we've done is I've incorporated specific exercises that he can do when he's sitting or standing in front of his computer. And by alternating his postures in front of the computer, this has actually improved his reported symptoms from sitting all day. And also it doesn't look like that they are going out of their usual routine to perform their exercises as well. And the last part, I guess, in terms of making the most of the participants' involvement is ensuring that the exercise and activities are easy to perform, but also achievable. I mean, we never want to set the participant to fail, or we never want the participant to, to feel that, we want them to feel that they are accomplishing something and they're making gains. So we never want to make it difficult for anyone, but want to make them easier to perform, but also something that they will actually achieve as well. So really, by keeping the exercises and activities simple and achievable, it will actually improve their confidence and their motivation. And obviously, once the program is underway and they've demonstrated great compliance, we can then look at advancing their program by incorporating maybe more challenging activities or intensive exercise, and then progressing from there as well. So the next factors for successful development and implementation of the physio program. So another one is compliance, but it's about time. So as I said, even myself, we always use time as an excuse not to do something. And again, this is about how can we manage that, that barrier. So really it's all about ensuring, again, one is that they're ensuring that they're completing as part of their individual home program. but also performing at the participant's best time of the day. Obviously, we don't want to be seeing participants when they're at their worst. For instance, I know some participants maybe function better in the morning than compared to the afternoon, or maybe they need a few hours before their painkillers kick in before engaging in the program. Participants will be a lot more motivated and engaged when they are at their best. So a few of my participants who've got significant pain issues, they find that towards the end of the day is when they're a lot fatigued, when their pain's increased. So it's probably not a good time to actually be performing the program then. We want to do it at their best. So if their best is during the day or in the morning, that's the best time to participate in the program, because they're going to be able to get more out of it as well. The last thing we want is for a participant to be completing the program or exercises when they're already in a lot of pain, because obviously then most likely they will be in significant amounts of pain that they will probably need longer time to actually recover from that as well. Obviously using timely cues. So a lot of people sort of ask, you know, how often should I be doing my exercise? How often should I be engaging in my program? And really just using timely cues. So one that I would tend to use is, for example, before meals, or when you wake up, or before you go to bed, because it is things that people will automatically do as part of their day-to-day routine. If the participant has 3 meals a day and has, you know, poor memory, then I'll go, yep, just do it before breakfast, lunch and dinner. So it's a great reminder. Again, we can use post-it notes or visual reminders on their fridge before they start to complete their meal preparation. You know, when they go to their fridge, they go, oh, hang on, I'm about to have breakfast here, but I know I need to do my exercises. That's a great cue that they can use as well. Obviously now with technology these days, we've got mostly everyone has smartphones, so we can use phone reminders to provide, you know, reminders through alarm or voice alerts, and can also be set up on your computer as well. So particularly if they're spending all day every day in front of their computer, you can get alert pop-ups to sort of remind you, you know, do your exercises or do your activities or stand up or whatever it may be as well. But also a good one to consider is shorter quality sessions versus longer sessions with adequate rest breaks. Obviously, every participant is different. Depending on their fatigue levels or their endurance, some participants may prefer to complete just one big session in their day, but then obviously incorporating sort of little rest breaks in between. But some may benefit from shorter sessions throughout the day, particularly if they've got, you know, poor endurance from that perspective. So for example, you know, they could be maybe completing 2 different exercises before each meal. So in total, they're actually completing 6 different exercises in the day. So again, for example, my 7-year-old participant that I see with the very short attention span, we found that performing any sessions longer than 30 minutes, she starts to become disengaged, and she needed significant prompting from myself and the mother to actually you know, participate and engage. But we found that she was just fatigued by after 30 minutes. So we found that we got the best within that 30 minutes. So we found that once 30 minutes is up, she pretty much will say thank you and goodbye. Then we knew that that was pretty much enough. We didn't want to get her to a breaking point or her fatiguing point in that sense. So another factor for successful development and implementation of the physio program is considering the resources and equipment. So, you know, as mobile physiotherapists, we try to avoid using fancy equipment or tools that you may see in private practice, for instance. Maybe the most we might utilize would be TheraBands for strengthening. Really what we try to utilize is utilizing what's around the home. So if we are doing sessions at home, incorporating household items as part of their program. So for example, I've used pillows for resistive exercises, weighted objects, you know, for strengthening. You can fill up empty bottles with rocks or sands, or particularly, you know, those who's got young babies. I know when I had my baby, I used my baby as a bit of a weight to do sort of squatting type exercise. So again, it's just about being creative and seeing what you've got in your space. And again, that's also going to help with compliance, because if they're using everyday household items that you're used to, you're probably going to get more engagement out of that than any sort of fancy equipment. For example, another participant that I see, we use a broom or an umbrella to do range of motion exercises to improve his shoulder range of motion. So again, there's so many options and things that we can use as well. If the location of their program is at home, you know, do they have a backyard? Could we utilize that space? Could we maybe set up obstacle courses? Or again, we can do that indoors as well. And again, we can look at walking on uneven surfaces, or, you know, we could set up obstacle courses and like that to help improve their balance, their mobility. And then also if they've got access to stairs as well, that's great for lower limb strengthening and for balance as well. So of course, we need to ensure that the activities and exercises are able to be safely performed, and where required, will obviously be supervised with the support staff or a family member when performing independently as well. So one thing that we also provide is exercise sheets with diagrams and clear instructions. You know, I mean, how many times have I seen when I worked in private practice where a patient of mine has told me, oh, don't worry about giving me an exercise sheet, I will remember. I'll see them in about a week or 2 weeks later, and they've pretty much said, oh, I totally forgot what I needed to do. Happens quite a lot. So as physiotherapists, we should always provide exercise sheets with diagrams and clear instructions. Even if they don't want it, I would still give it anyway, because I think just having that extra piece of tool or sheet is definitely useful, because I find a lot of people tend to forget what they need to do, or they forget how to do it as well. So, you know, and particularly sometimes sessions can be quite overwhelming, especially when there's, you know, so much information going on, or there's a lot of instructions and things like that. So really just having something visual that they can follow and can be used as a guide so that they're performing it correctly, especially when they're on their own as well. So as I said, I've got one of my participants who's legally blind. Even though he can't read the exercise sheet, I've still printed it out, and I've actually incorporated his support worker who's aware of all the exercises that he needs to do, so that every time when my participant wants to perform his exercises, he can refer to his support worker who can follow through the sheet to make sure that he's actually doing it correctly as well. Another thing also to point a note is, I guess, the placement of these exercise sheets. Again, putting it in a drawer, it's most likely it's going to stay in the drawer and never be touched again. People, they lose papers all the time. So I always make sure that these exercise sheets are in a place that is visible, but it's also going to act as a timely cue or a prompt to complete the exercises. For some people, as I said, if they're doing the exercises before meals, I would recommend pop it up onto the fridge so it's more visible. Or again, for my participant who's on the computer all day, every day, I would place it right next to his computer. So really he's got no excuse, because it's right there in front of him as well. Another thing now, especially with technology, is video. So particularly if the participants like to be shown what to do, we can actually record them performing the exercises, or we can record myself doing the exercises. And again, they can pretty much refer to their phone to see if they're doing it correctly as well. So I guess as a physiotherapist, it's really, I guess, too important to note for us is that we always assess and reassess at every session. We obviously need to ensure that any advice or education or activities or exercises that are being prescribed are effective as well. So for example, I've got a 50-year-old female with multiple sclerosis who's wheelchair bound. I introduced some bed-based exercises for the first time in our second session. Initially, she was showing some difficulty. She had really poor activation of her muscles, but then with repetition and rest breaks, when I assessed her about 15, 20 minutes later, her movements had actually improved just in that short time span. So you can imagine if she continued with the program independently, I would anticipate further improvements the next time when I see her as well. The other thing as well is reviewing the progress and really listening and observing any feedback from the participants or their supports. We obviously need to ensure that the participants are on track, that they're compliant, that they're engaging within the program, but also taking into consideration any feedback. And this is to ensure that the program has the ability to be amended, altered or modified to suit the participant as things progress or doesn't progress as well. And also really ensuring progression of the program for further development and improvements. Obviously, just like for those people who like to go to the gym, if we did the same weights, the same repetition for each session for 6 months, you're probably not going to be gaining increases in strength. So the only way to improve that is we need to enhance or modify the exercises, whether it's increasing the weight, increasing the repetition or the sets or the movement, or making the task a little bit more challenging or changing the level of difficulty. This is going to ensure that you know, they continue to further improve, but they're actually you know, on the right track to further improving their movements, function, mobility, as opposed to just staying plateau as well. So that pretty much ends the webinar. Does anyone have any specific questions that they wanted to ask? And you can use the chat function on the Zoom. Okay, well, if there's no further questions, I appreciate your time in the webinar and look forward to seeing, oh, sorry, yes, there is a question. Yes, so this question is, I had a participant ask if physios are hands-on, will they massage, etc. Yes, I can say that as physios, we are hands-on, and it really just depends on the need. So if a participant has significant, you know, muscle contractures, or if they've got significant tightness in their, let's say, a common one we normally get is in the neck or the upper traps where they're quite tight. And, you know, even though we're doing stretching exercise and things like that, if sometimes they might need a bit of hands-on or manual therapy, we can definitely include that as part of the program as well. I've got a number of participants who do have significant tightness in there, that doing exercise alone isn't enough. We're having to also include some manual therapy, some mobilizations and massage just to help to relieve that. And we find that doing that before we do the exercises can actually help give them a little bit more movement as well. I hope that answers your question.